All right, this is the video competency for measuring a height, weight, and head circumference on an infant for MA 130. So the first step, as usual, is to go wash your hands and gather your equipment. So you're going to do a medical aseptic hand wash. Come get the infant's chart, okay, the patient's chart. In this case, it's going to be an infant. Make sure you have a tape measure in your room. There should be a tape measure in the top drawer of each exam room. You want to make sure you have a black pen and a paper towel or a professional towel to put on the scale. You want to make sure that your exam table is totally flat, and that'll be important in just a minute, okay? So I have washed my hands, I've gathered my equipment. Now normally what I'll do is I'll have a classmate, or it'll be myself, pretend to be the mom and kind of bring the baby in, okay? So we're going to kind of go off script for that piece just for this video presentation. So what you'll do is you'll come out and you'll call the baby, Harry Chest or whatever the baby's name is. Mom will bring baby in. You'll greet mom. Hi mom, how's Harry doing today? Mom will say, oh yeah, just fine, whatever. And then you're going to ask the parent or the caregiver to undress the infant down to their diaper. So ask the parent to undress the baby, but leave the diaper on, okay? So I'm gonna do this part as the medical assistant, just because, like I said, I don't have a parent or a caregiver here right at this time. So we're gonna take the baby's onesie off, leave the diaper on, okay? And then if the mom put the baby on the table, you'll pick the baby up, or you'll just take baby from mom, okay? So now I have baby with their diaper on, and I'm going to come around over here to my baby scale, to my infant scale. Diaper's still on. I'm going to lay the baby on the scale. I've put my professional towel or my paper towel down to avoid cross-contamination. I'm always going to kind of have a hand on my baby until I get the actual measurement. Before I take the actual weight measurement, I want to take that diaper off, okay? So I quickly, especially if you have little boys, they have a tendency to pee. I'm going to have my baby on there, and then I'm going to come up here and I'm going to get a weight on my baby. We're going to add the bottom and the top together just like we did adults, okay? So I'm going to start out at 0 on the bottom, and the large numbers up here are pounds, okay? So this is 3 pounds, 4 pounds, 5 pounds. Every small number, which is different than what we've used so far, is 1 ounce, okay? So let me go ahead and balance my scale here. Okay, so in your head, see if you can tell what that is. Again, large numbers are the pounds, small numbers are the ounces, so we're gonna have blank pounds and blank ounces. This scale, this baby right now is measuring 5 pounds, 10 ounces. It's kind of between the 9 and the 10 there. So see, there's 8 ounces, 9 ounces, 10 ounces, a little bit closer to the 10. So I'm going to round it up to 5 pounds, 10 ounces. Okay. I have my measurement. I'm going to turn it back to 0 as quickly as possible. I'm going to get that little diaper back on my baby so I don't have to clean up a mess. And then I'm going to support the baby's head and take the baby off the scale. So now what I'm going to do is go ahead and go over to my chart, and I'm going to document my 5 pounds, 10 ounces in the chart, okay? I either give baby back to mom or I lay baby here. Make sure you keep a hand on the baby. Don't ever put your baby down and turn your back on it or just leave the baby. Even if you think mom has the baby, unless mom has baby in their arms. Nowadays, parents, they'll get into the room and they'll get on their phone and you lay the baby down thinking mom's got it, mom thinks you have it, so you don't want to have an incident like that. Either physically hand that baby to mom to where she takes it, or you need to make sure that you are protecting that child at all times, okay? All right, so that's how we're gonna take the weight. Next thing we're gonna do is the baby's length. So I'm gonna lay the baby on a flat table. This is why your exam table needs to be flat. If it's at an angle, that's not the same as flat. That distance is different, and that's how we're gonna measure this particular baby. So what I'm gonna do, it doesn't matter if you start at the head or the feet, to take a length on a baby or a height, you're gonna take your pen, come to the top of the skull and go straight down. Don't angle in, don't angle up, straight down and make a nice good mark. Then you're gonna come down, stretch out, because babies have a tendency to be all squinched up because they're cold and wanna be warm. And you need to do this quickly because they don't hold still very long. You're gonna stretch out that foot, and at the base of the ankle, you're gonna make another mark on the table paper, okay? So then what you're gonna do, you just leave those marks, and then you can take a head circumference. So you're gonna take the tape measure and you're going to wrap it around the occipital protuberance and the supraoccipital ridge, okay? So the supra, meaning above, occipital, meaning eye. So right above the eyebrow is that ridge, and around the biggest flat part, back part of the head, and you want the measuring tape to be flat, okay? So again, this is a little difficult to do, easier on a mannequin here in class, and then you're gonna note where that marking is, okay? So in this case, this tape measure is in 16ths. So what I have here, I'm trying to pull this up so you can see. I have 13 and 1/2/16, okay? 13 and 2/16 inches. 2/16 reduces to 1/8. So head circumference is 13 and 1/8 inches, and I'm going to document that in my chart, okay? So I write that down. Now I'm gonna take baby, give baby back to mom, okay? So hand the baby off to mom, and I'm gonna take my tape measure and I'm gonna go back and I'm gonna measure the baby's height with the 2 lines that I had, okay? So the edge of the tape measure right at the first line, and then my second line is where I'm gonna measure. Sometimes your lines will be like this, and as you can see, if my line is over here and I don't measure straight up and down, that's a huge difference. So if I measure here, I have right at 18, and again, we're in 16ths. So we're gonna go 1, 2, 3, 4, 5, 6, 7/16 is what I'm measuring this. 18 and 7/16 inches, okay? Now, if I measured it at an angle, you see how now it's like 19 inches, all right? So that's why the table needs to be flat, your tape measure needs to be straight up and down to get an accurate reading, okay? Some tape measures are in 1/8 and not 16ths. Some are in 4ths. So you have to know what you're dealing with in order to measure accurately, all right? So now I have my height, I have my weight, I have my head circumference all on my baby. So what I would do now is, again, mom or caregiver has baby, tell them to go ahead and get them dressed, and you can let them be dismissed from the room. In real life, we would wait for the doc to come in and see the baby, right? Keep them undressed because he's going to listen to their heart and to their lungs and everything. But for our comp, you're going to dismiss them and just document those 3 things in the chart. The other thing on the comp sheet, but we're not going to do at the same time in class, is this is what a growth chart looks like. So there's height, weight, and head circumference on here. We're going to do this as a separate activity in class. So there's growth charts for males and females. So this was a female because I have a pink one. So there's the head circumference. I'll show you in class how to plot those. Here's the height, and here's the weight. So we're going to plot those on there. So if this baby's coming in for, say, a 6-month well baby check, we'd plot those 3 things on the 6-month line and be done with it. The exercise we're going to do in class is we're going to do like 2 years worth of growth plotting, just so you get the kind of the hang of it and kind of doing that longitude and latitude and putting it on there in an appropriate and accurate spot. So like I said, this is kind of separated from the comp, even though it's on the comp sheet, so I wanted to mention it here in the video. But bottom line, once you have your 3 measurements, you're going to hand baby back to caregiver, dismiss mom and baby. You can go ahead and have a seat and wait in the waiting room until the doctor is ready for you. Finish up your documentation, clean your room, which includes getting rid of the paper towel on the scale and your table paper. Okay, so that'll be it for this one.